Hello, welcome to this week's treatment group video on somatic symptom and related disorders. I will be presenting on factitious disorder imposed on another. My name is Dr. Miah Taylor and my client's name is Deborah George. She is 21 years old. So the differential diagnosis, there's only one, and it is factitious disorder imposed on another, and that was ruled in because our client was making her daughter ill. The primary diagnostic features, there are two. The first one is individual falsifies or infects physical or psychological symptoms upon a victim for the purpose of presenting the victim as sick or injured. And the second one is deception is engaged in without obvious external rewards. So our client, Deborah George, grew up in a pretty neglectful family. Her parents were both alcoholics, and they often forgot to shop for her, and so they would leave her to kind of fend for herself as young as 7 years old. And at one point, she was actually severely beaten to the point where she had to stay in the hospital for a little while, and she recounts that as being one of the best experiences of her life, being in the hospital, just because she got attention and kind of felt that connection to people that she hasn't really ever had. Now, many years later, she has a daughter. She's a single mother, and her daughter has been in and out of the hospital many times with different illnesses, from throwing up to having trouble breathing, and the nurses and doctors got worried that Deborah might be the reason for her daughter's illnesses, because she kind of showed some kind of odd behaviors that you wouldn't usually see in a parent that's worried about their child, one of which being her getting really excited about being in the hospital and kind of wanting all the attention on her, even sometimes pulling the attention away from her daughter. And so as soon as the doctors kind of got on that, they had her removed, and within a day her daughter was already doing better. And later on she did say that she was infecting her daughter in order to get her sick. And so sadly her daughter was placed in foster care, and that is where she resides as of now. So, the multi-axial diagnosis, on axis 1, it is factitious disorder imposed on another. Axis 2 is none. Axis 3 is none. Axis 4, physical abuse by father, and then also raised in a negligent home. And then on axis 5, the GAF is 48. We have 3 theoretical perspectives. The first is the behavioral perspective. Deborah may have a faulty learning experience. She could have been operantly conditioned because from a young age she made the association between being in the hospital and receiving attention. And so that association was positively reinforced when she would take her daughter to the hospital and get that attention again. And so that kind of led to her continuing to poison her daughter so that she could be in that environment. The next one is the cognitive perspective. Deborah may have an irrational belief that making her daughter ill is a viable option for getting her need for attention met. She may believe that the hospital is the only place where she is able to get that love and attention. And so again, she made her daughter ill so that she could be there. The final one is the family perspective. Deborah was raised in an abusive and negligent home, and so that environment made her feel unloved and not really cared for. But after she was injured and placed in the hospital, she found the love and nurturance that she was craving, which led her to later in life find a way, which was making her daughter ill in order to be in the hospital setting. And that is it for our client. Thank you so much.